Masks are designed to protect the mouth and lip area. They should be worn whenever eye protection is used. Lab coats and other protective clothing provide protection for much of the body. They should be selected based on the degree and circumstances of anticipated exposure and must effectively prevent the pass-through of fluids and materials. Gowns with total frontal coverage do the best job of protecting street clothes from contamination. Surgical caps and hoods should be worn whenever gross contamination is anticipated, such as during autopsies or in orthopedic surgery. Shoe covers should also be worn in these situations, as well as when cleaning up spills of significant size. Your facility has personal protective equipment available for you in your work area. If you are unsure of the location of a particular item, ask your supervisor. You also need to be aware of your facility's procedures for handling personal protective equipment once it has been worn. Know the location of collection and disposal points and use them. Remember, you must take off your personal protective equipment before leaving your work area. Good work practices and the use of personal protective equipment can substantially reduce the risk of exposure. Vaccination, however, is the first line of defense against infection. There is, of course, no vaccine for HIV or hepatitis C. However, a vaccine against hepatitis B has been available for some time. The vaccine is administered in 3 injections, given several months apart. Hepatitis B vaccines are safe. There is no possibility of infection through the vaccine itself. Your employer has set up a free hepatitis B vaccination program for all employees who are at risk of exposure. Your training instructor can give you more information. If you are at any risk, it is important that you be vaccinated. It is so important that OSHA requires you to sign a form if you decline the vaccination. If you are accidentally exposed to hepatitis B infected blood and have not been vaccinated, your employer will offer you an accelerated vaccination series, also at no cost. This after-the-fact vaccination will not always prevent you from developing the disease. However, many forms of hepatitis B are slow to develop. Given in time, vaccination may prevent the infection. As careful as we may be, needle sticks, blood leakage, and spills can occur. You need to know what to do in case of such an emergency. First, if you have come into contact with any potentially contaminated material, you should wash the affected area with soap and water as quickly as possible. If the incident involves a spill or leakage, you should soak up the material or contain it using absorbent barriers. Next, the area should be cleaned with your facility's approved disinfecting solution, such as diluted bleach. Once the spill or leak has been dealt with, any contaminated materials should be disposed of in an approved waste disposal container. Any contaminated personal protective equipment that is disposable should also be discarded. Reusable equipment should be recycled for decontamination. A number of people will need to be notified about the incident, including your supervisor, your Environmental Services Department, and the Infection Control Group. You may also need to complete an incident report. If the injury was caused by a contaminated sharp, your facility will record it in a special Sharps Injury Log. This log is specifically set up to keep track of percutaneous injuries from contaminated sharps. Every entry into the log must include the following information: the type and brand of device involved in the incident, the department or work area where the accident took place, and an explanation of what happened. Immediately following the exposure, your employer will give you a written description summarizing the routes of exposure you experienced, the circumstances under which the exposure occurred, and, if possible, the identity of the individual from whom the potentially infectious material originated. Your employer will also try to determine if the source individual's blood is infected with hepatitis B, hepatitis C, or HIV. An appointment will be arranged for you with a healthcare professional to review the medical ramifications of what took place. Your employer will provide the healthcare professional with information such as the type of work you were doing when the incident occurred, the result of the source individual's blood test, and any of your medical records which are relevant to possible treatment. With your permission, your blood will also be tested to determine if an infection has occurred. Your situation will then be evaluated and discussed with you. If appropriate, medical treatment may then be recommended. If hepatitis B vaccination is called for, it will be provided by your employer at no cost to you. The healthcare professional is also required to verify 4 things with your employer: that you have been informed of the results of their evaluation, that they have discussed with you any medical condition resulting from the exposure which would require follow-up, whether hepatitis B vaccination is called for, and whether you have received the first part of the vaccination series. All other information that results from your medical evaluation will remain confidential. Blood-borne pathogens are dangerous, but by combining engineering controls, good work practices, hepatitis B vaccination, and the use of personal protective equipment, we can protect ourselves and others from exposure.